Breast cancer is treatable, but it can also be life-threatening if not detected early. What is breast cancer? Cancer occurs when changes called mutations take place in genes that regulate cell growth. The mutations let the cells divide and multiply in an uncontrolled way. Breast cancer is cancer that develops in breast cells. Typically, the cancer forms in either the lobules or the ducts of the breast. Lobules are the glands that produce milk, and ducts are the pathways that bring the milk from the glands to the nipple. Cancer can also occur in the fatty tissue or the fibrous connective tissue within your breast. The uncontrolled cancer cells often invade other healthy breast tissue and can travel to the lymph nodes under the arms. The lymph nodes are a primary pathway that help the cancer cells move to other parts of the body. Signs and symptoms of breast cancer. Although breast cancer generally shows no symptoms in the early stage, timely detection can turn a story of breast cancer into a survivor's tale. Causes of pain and tenderness. We often associate pain with something wrong, so when women feel tenderness or pain in their breast, they often assume it to be breast cancer. However, breast pain is rarely the first noticeable symptom of breast cancer. Several other factors can cause the pain. Clinically known as mastalgia, breast pain can also be caused by the following: the fluctuation of hormones caused by menstruation, some birth control pills, some infertility treatments, a bra that doesn't fit, breast cysts, large breasts, which may be accompanied by neck, shoulder, or back pain, stress. Breast cancer signs and symptoms. Although a lump in the breast is typically associated with breast cancer, much of the time such lumps aren't cancer. Most are benign or non-cancerous. Common causes of benign breast lumps include breast infection, fibrocystic breast disease, lumpy breasts, fibroadenoma, non-cancerous tumor, fat necrosis, damaged tissue. With fat necrosis, the mass can't be distinguished from a cancerous lump without a biopsy. Even though the majority of breast lumps are caused by less severe conditions, new, painless lumps are still the most common symptom of breast cancer. Early on, a woman may notice a change in her breast when she performs a monthly breast exam or minor abnormal pain that doesn't seem to go away. Early signs of breast cancer include changes in the shape of the nipple, breast pain that doesn't go away after your next period, a new lump that doesn't go away after your next period, nipple discharge from one breast that is clear, red, brown, or yellow, unexplained redness, swelling, skin irritation, itchiness, or rash on the breast, swelling or a lump around the collarbone or under the arm. A lump that is hard with irregular edges is more likely to be cancerous. Later signs of breast cancer include retraction, or inward turning of the nipple, enlargement of one breast, dimpling of the breast surface, an existing lump that gets bigger, an orange peel, texture to the skin, vaginal pain, unintentional weight loss, enlarged lymph nodes in the armpit, visible veins on the breast. Having one or more of these symptoms doesn't necessarily mean you have breast cancer. Nipple discharge, for example, can also be caused by an infection. Men and breast cancer. Many people don't realize that men have breast tissue too, and those cells can undergo cancerous changes. Because male breast cells are much less developed than women's breast cells, breast cancer in men isn't as common. However, male breast cancer is not uncommon, it is just less than female. The most common symptom of breast cancer in men is a lump in the breast tissue. Other than a lump, symptoms of breast cancer in men include thickening of the breast tissue, nipple discharge, redness or scaling of the nipple, a nipple that retracts or turns inward, unexplained redness, swelling, skin irritation, itchiness, or rash on the breast. Most men don't regularly check their breast tissue for signs of lumps, so male breast cancer is often diagnosed much later. Types of breast cancer. There are several types of breast cancer, and they're broken into two main categories: invasive, and non-invasive, or in situ. While invasive cancer has spread from the breast ducts or glands to other parts of the breast, non-invasive cancer has not spread from the original tissue. These two categories are used to describe the most common types of breast cancer, which include ductal carcinoma in situ. Ductal carcinoma in situ, DCIS, is a non-invasive condition. With DCIS, the cancer cells are confined to the ducts in your breast and haven't invaded the surrounding breast tissue. Lobular carcinoma in situ. Lobular carcinoma in situ, LCIS, is cancer that grows in the milk-producing glands of your breast. Like DCIS, the cancer cells haven't invaded the surrounding tissue. Invasive ductal carcinoma. Invasive ductal carcinoma, IDC, is the most common type of breast cancer. This type of breast cancer begins in your breast's milk ducts and then invades nearby tissue in the breast. Once the breast cancer has spread to the tissue outside your milk ducts, it can begin to spread to other nearby organs and tissue. Invasive lobular carcinoma. Invasive lobular carcinoma, ILC, first develops in your breast's lobules and has invaded nearby tissue. Other, less common types of breast cancer include Paget disease of the nipple. This type of breast cancer begins in the ducts of the nipple, but as it grows, it begins to affect the skin and areola of the nipple. Phyllodes tumor. This very rare type of breast cancer grows in the connective tissue of the breast. Most of these tumors are benign, but some are cancerous. Angiosarcoma. This is cancer that grows on the blood vessels or lymph vessels in the breast. 1. Inflammatory breast cancer. Inflammatory breast cancer, IBC, is a rare but aggressive type of breast cancer. IBC makes up only between 1 and 5% of all breast cancer cases. With this condition, cells block the lymph nodes near the breasts, so the lymph vessels in the breast can't properly drain. Instead of creating a tumor, IBC causes your breast to swell, look red, and feel very warm. A cancerous breast may appear pitted and thick, like an orange peel. IBC can be very aggressive and can progress quickly. For this reason, it's important to call your doctor right away if you notice any symptoms. 2. Metastatic breast cancer. Metastatic breast cancer is another name for stage 4 breast cancer. It's breast cancer that has spread from your breast to other parts of your body, such as your bones, lungs, or liver. This is an advanced stage of breast cancer. Your oncologist, cancer doctor, will create a treatment plan with the goal of stopping the growth and spread of the tumors. 3. Triple-negative breast cancer. Triple-negative breast cancer is another rare disease type, affecting only about 10 to 15% of people with breast cancer, according to the American Cancer Society, ACS. To be diagnosed as triple-negative breast cancer, a tumor must have all three of the following characteristics. It lacks estrogen receptors. These are receptors on the cells that bind, or attach, to the hormone estrogen. If a tumor has estrogen receptors, estrogen can stimulate the cancer to grow. It lacks progesterone receptors. These receptors are cells that bind to the hormone progesterone. If a tumor has progesterone receptors, progesterone can stimulate the cancer to grow. It doesn't have additional HER2 proteins on its surface. HER2 is a protein that fuels breast cancer growth. If a tumor meets these three criteria, it's labeled a triple-negative breast cancer. This type of breast cancer tends to grow and spread more quickly than other types of breast cancer. Triple-negative breast cancers are difficult to treat because hormonal therapy for breast cancer is not effective. Breast cancer stages. Breast cancer can be divided into stages based on the size of the tumors and how much it has spread. Cancers that are large and/or have invaded nearby tissues or organs are at a higher stage than cancers that are small and/or still contained in the breast. To stage a breast cancer, doctors need to know if the cancer is invasive or non-invasive, how large the tumor is, whether the lymph nodes are involved, if the cancer has spread to nearby tissue or organs. Breast cancer has 5 main stages, stages 0 to 5. 1. Stage 0 breast cancer. Stage 0 is DCIS. Cancer cells in DCIS remain confined to the ducts in the breast and have not spread into nearby tissue. 2. Stage 1 breast cancer. Stage 1A. The primary tumor is 2 cm, cm, wide or less, and the lymph nodes are not affected. Stage 1B. Cancer is found in nearby lymph nodes, and either there is no tumor in the breast, or the tumor is smaller than 2 cm. 3. Stage 2 breast cancer. Stage 2A. The tumor is smaller than 2 cm and has spread to 1 to 3 nearby lymph nodes, or it's between 2 and 5 cm and hasn't spread to any lymph nodes. Stage 2B. The tumor is between 2 and 5 cm and has spread to 1 to 3 axillary, armpit, lymph nodes, or it's larger than 5 cm and hasn't spread to any lymph nodes. 4. Stage 3 breast cancer. Stage 3A. The cancer has spread to 4 to 9 axillary lymph nodes or has enlarged the internal mammary lymph nodes, and the primary tumor can be any size. Tumors are greater than 5 centimeters, and the cancer has spread to 1 to 3 axillary lymph nodes or any breastbone nodes. Stage 3B. A tumor has invaded the chest wall or skin and may or may not have invaded up to 9 lymph nodes. Stage 3C. Cancer is found in 10 or more axillary lymph nodes near the collarbone, or internal mammary nodes. 5. Stage 4 breast cancer. Stage 4 breast cancer can have a tumor of any size, and its cancer cells have spread to nearby and distant lymph nodes as well as distant organs. The testing your doctor does will determine the stage of your breast cancer, which will affect your treatment. Note: the next video HealerCare USA will help you understand tests that help diagnose the type of breast cancer and determine what stage the cancer is in. The most appropriate and effective treatment for each type and stage of breast cancer. We invite you to watch. Thanks.